Welcome to the WeRPN Online Learning Indigenous Health Equity, Module 3, Policy, Advocacy, and Indigenous Equity, developed by WeRPN with the support of the Government of Ontario. In the development of these modules, WeRPN consulted with an Indigenous health subject matter expert who specializes as an Indigenous patient navigator. In addition, the modules were reviewed by an Indigenous elder. We thank them for their time and their contributions. It is imperative to understand the key policies regarding healthcare for the Indigenous populations in Canada. Let's start with the 1867 British North America Act, which was the first Indigenous health legislation in Canada, marking the beginning of formal health policies for Indigenous peoples. The 1979 Indian Health Policy is based on three pillars: community development, traditional relationships, and the Canadian health system. The first pillar, community development, emphasizes the importance of empowering Indigenous communities to identify their health needs and develop appropriate health programs. The second pillar, traditional relationships, focuses on recognizing and respecting the traditional healing practices and knowledge of Indigenous peoples. The third pillar, the Canadian health system, seeks to integrate Indigenous health services within the broader Canadian healthcare system, ensuring that Indigenous peoples have access to the same quality of healthcare as other Canadians. Moving forward, the Constitution Act from 1982, specifically Section 35, outlines the inherent right of Indigenous communities to self-govern on internal matters affecting their communities, lands, and resources. This act aims to allow for the integration and maintenance of the culture, traditions, and languages. The 1985 Indian Act further outlines governmental obligations towards the Indigenous populations, including laws pertaining to the management of reserve land and Indigenous status. Finally, the Health Transfer Policy from 1988 allocates partial control of health-related resources to Indigenous governance, empowering communities to have a greater say in their healthcare. In our efforts to ensure equitable healthcare for Indigenous populations, it's important to understand the historical context and evolution of these policies. The legislative milestones represent the foundation upon which the current and future health initiatives are built. By recognizing the significance of these acts and policies, we can better appreciate the ongoing challenges and work towards solutions that honor the rights and needs of Indigenous peoples. A culturally paramount piece of legislation, Culturally Indigenous Health, is the Truth and Reconciliation Commission of Canada, an initiative aimed at addressing the historical and ongoing impacts of residential schools on Indigenous communities. The Indian Residential Schools Agreement, established in 2007, is the largest class action settlement in Canadian history. This agreement outlines comprehensive efforts to promote reconciliation between all Canadians and former Indigenous students, their families, and affected communities. Central to these efforts is the recognition and healing of deep wounds caused by residential schools. The Truth and Reconciliation Commission's work has been instrumental in bringing to light the stories and experiences of survivors, fostering a national dialogue on the importance of reconciliation. Moreover, the United Nations Declaration on the Rights of Indigenous Peoples, adopted in 2007, provides a global framework for recognizing and protecting the rights of Indigenous peoples. This declaration emphasizes the importance of self-determination, cultural preservation, and the protection of Indigenous lands and resources. These initiatives underscore the commitment to acknowledging past injustices and working towards a future where Indigenous rights are fully respected and integrated into the broader Canadian society. Understanding and supporting these efforts is crucial for fostering genuine reconciliation and building a more inclusive and equitable nation. There are 94 calls to action, and actions 18 to 24 focus on improving healthcare access and outcomes for Indigenous peoples. These actions emphasize providing culturally competent healthcare services, ensuring equitable access to care, and integrating traditional healing practices. They call for the elimination of health disparities, improved access to medical services, and the development of policies that respect Indigenous languages and traditions. By incorporating Indigenous ways of knowing and being into healthcare systems, it further highlights the changes made to the College of Nurses of Ontario Code of Conduct that focuses on culturally competent care. In addressing critical healthcare disparities, several key calls to action have been identified. Calls to action are specific recommendations designed to prompt individuals or organizations to take meaningful steps towards addressing particular issues or achieving specific goals. Call to Action 19 outlines a pressing need to close the significant gaps in healthcare outcomes between Indigenous and non Indigenous communities. For example, initiatives could focus on improving access to preventative care and chronic disease management services in remote Indigenous communities where healthcare access is often limited. Call to Action 21 depicts federal funding proposed for Indigenous healing centers to comprehensively address the physical, mental, emotional, and spiritual needs of the Indigenous populations through culturally appropriate practices. For instance, funding could support the establishment of centers that integrate traditional healing methods such as smudging and sweat lodge ceremonies, along with conventional medical treatments. Call to Action 22 describes a healthcare system that recognizes the value of Aboriginal healing practices and uses them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. Call to Action 23 describes a crucial step in increasing the number of Indigenous professionals within the healthcare sector. This initiative not only enhances cultural competency but also fosters trust and understanding between healthcare providers and Indigenous communities. For example, scholarships and mentorship programs could be implemented to encourage more Indigenous youth to pursue career in medicine, nursing, and allied health professions. Lastly, Call to Action 24 is imperative to integrate mandatory education on Indigenous health issues, the history of residential schools, and Indigenous healing practices into medical and nursing school curricula. Such educational reforms are necessary for equipping future healthcare professionals with the knowledge and sensitivity needed to provide culturally safe care. These actions collectively aim to promote equity, improve healthcare access, and enhance health outcomes for Indigenous peoples across Canada. The effectiveness of Indigenous policy legislation in Canada faces several limitations. These include insufficient integration of traditional healing practices within healthcare frameworks, hindering comprehensive care that aligns with Indigenous cultural beliefs and practices. Jurisdictional ambiguities further complicate matters, as federal, provincial, and municipal funding responsibilities often overlap or are inadequately defined, impacting the consistency and adequacy of healthcare services provided to Indigenous communities. For instance, taking a look at the funding and administration of mental health services for the Indigenous populations, the federal government may allocate resources for Indigenous mental health programs, but the delivery and implementation of these services often falls under provincial or territorial jurisdiction. This can lead to discrepancy in service availability and quality across different regions, as the provincial governments may have varying levels of commitment or capacity to support Indigenous specific mental health initiatives. Such ambiguities can hinder the consistency and effectiveness of mental health care for the Indigenous communities. Additionally, there is a notable lack of dedicated funding for Indigenous specific health programs, particularly those addressing the unique physical and demographic health needs of the Indigenous populations. Finally, the absence of a clearly defined method for enforcement undermines the implementation and impact of existing policies, potentially limiting their effectiveness in improving health outcomes and addressing systemic health disparities among Indigenous peoples in Canada. Health advocacy encompasses a range of activities aimed at improving healthcare access, navigating complex systems, mobilizing resources, addressing health inequities, influencing health policy, and affecting systemic change. It involves proactive efforts to ensure individuals and communities can access necessary healthcare services and resources, navigate bureaucratic challenges within the healthcare systems, and advocate for policies that promote equitable health outcomes. Health advocates play a crucial role in empowering individuals, communities, and organizations to address systemic barriers and advocate for improvements in healthcare delivery and policy. Health transformation projects initiated by the Government of Ontario aim to foster significant improvements in healthcare for Indigenous communities. These projects are designed to empower Indigenous communities by granting them greater control over their health services, thereby ensuring that healthcare initiatives align more closely with cultural beliefs and community needs. By improving coordination within the provincial health system, these initiatives seek to enhance the efficiency and effectiveness of healthcare delivery. Moreover, the integration of co developed distinctions based Indigenous specific legislation is pivotal, as it ensures that policies and services are tailored to address the unique health challenges and priorities of Indigenous peoples. Additionally, these projects support the establishment of Indigenous led health organizations, empowering communities to shape and manage their healthcare initiatives in ways that promote autonomy and cultural relevance. The role of the nurse in Indigenous healthcare advocacy includes several key responsibilities aimed at promoting culturally safe and effective healthcare. First, nurses are tasked with integrating traditional healing practices into patient care in a manner that is respectful, advocating for the collaboration with Indigenous elders and community leaders. This ensures that healthcare practices align with cultural beliefs and values, enhancing the overall health outcomes and experiences of Indigenous patients. Secondly, nurses play a crucial role in fostering and ensuring patient safety through culturally sensitive communication. This includes actively listening to patient concerns, respecting their cultural backgrounds, and adapting care plans accordingly to promote mutual understanding and trust. Lastly, nurses engage in continuous education and training to enhance their cultural competence and sensitivity in providing care to Indigenous populations. This ongoing learning process equips nurses with the knowledge and skills necessary to address diverse health needs while upholding cultural respect and awareness in their practice. Overall, the advocacy role of the nurse in Indigenous care is essential for promoting equity, improving healthcare outcomes, and building stronger relationships built on trust and cultural understanding. Indigenous health equity aims to ensure fairness and justice in health outcomes, addressing disparities that are avoidable and remediable among Indigenous populations. According to the World Health Organization, equity involves the absence of unfair differences in health between various social, economic, demographic, geographic, or other defined groups. It's important to distinguish equity from equality. While equality focuses on treating everyone the same, equity recognizes that different groups require different resources and approaches to achieve their fair health outcomes. In the context of Indigenous health, equity means providing tailored healthcare solutions that address historical injustices, systemic barriers, and unique cultural needs to achieve truly equitable health outcomes for Indigenous communities. Health disparities serve as a crucial metric for assessing progress towards achieving health equity. They reflect the differences in health outcomes between population groups and highlight areas where inequities persist and need to be addressed. Thus, as efforts are made to improve health equity, there is typically a reduction in health disparities. Statistically, Indigenous populations in Canada experience significant health disparities compared to non Indigenous populations. This includes higher rates of chronic disease such as diabetes and hypertension, lower life expectancy, and elevated rates of mental health concerns, including substance abuse. These disparities emphasize the urgent need for culturally appropriate healthcare initiatives and systemic reforms that address the underlying social, economic, and systemic factors contributing to these disparities. Access to healthcare remains a significant challenge for many Indigenous groups in Canada, particularly those living off reserves and in remote areas. According to recent data, 20.3% of First Nations, 17.9% of Métis, and 56.5% of Inuit populations report having no access to a regular healthcare provider, compared to 14% of non-Indigenous populations. Regular healthcare providers include family doctors, specialists, nurses, pharmacists, and social workers. This disparity highlights the need for improved healthcare infrastructure and access to essential healthcare services in Indigenous communities. Furthermore, Indigenous people living in remote areas often face extended wait times of upwards of 2 weeks to access care from a regular healthcare provider. This geographic barrier reinforces the need for innovative healthcare delivery models and commitment to ensure equitable access to healthcare for all Indigenous peoples across Canada. Efforts to improve access to healthcare for Indigenous communities involve several key strategies aimed at addressing barriers and enhancing service delivery. Educational support programs are crucial in increasing access to higher education for Indigenous individuals, which can mitigate inadequate education that often results in poor literacy and reduces one's ability to navigate the healthcare system effectively. Programs like Inspire, supported by Indigenous Services Canada, offers scholarships and bursaries specifically for skilled trades, apprenticeships, and technology programs, empowering Indigenous youth to pursue careers in healthcare and other fields. Another essential initiative is the Aboriginal Patient Navigator program, which enhances healthcare accessibility by providing Indigenous interpreters trained in medical terminology. These navigators play a vital role in bridging communication gaps between healthcare providers and Indigenous patients, ensuring culturally competent care and improving patient outcomes. Additionally, the integration of telehealth services is critical for expanding access to specialized healthcare services while reducing travel and wait times, especially in remote Indigenous communities. Proposed initiatives by the provincial government in Ontario and federal government aim to provide high-speed internet access to 190 Indigenous communities, facilitating broader telehealth adoption and significantly improving healthcare access across remote regions. These strategies collectively aim to mitigate barriers to healthcare access, promote equity, and enhance healthcare outcomes for Indigenous populations in Canada. As a nurse, integrating strategies to support Indigenous health involves several key approaches. First, addressing social determinants that impact the health of Indigenous clients is crucial. This includes advocating for resources and supports to address factors such as housing, income, and education, which significantly influence health outcomes. Secondly, collaborating with Indigenous communities to understand their needs and priorities ensures culturally competent care and fosters trust in healthcare services. Educating clients about Indigenous designed health programs is another vital aspect of nursing practice. This involves promoting awareness and encouraging participation in programs that are specifically tailored to meet the needs and cultural preferences of Indigenous communities. Lastly, identifying barriers to healthcare accessibility and providing guidance on strategies to mitigate these concerns helps to improve healthcare equity. This may include advocating for improved healthcare infrastructure, facilitating access to healthcare telehealth resources, or providing culturally sensitive navigation support. A critical approach to integrating these strategies is a not to us, but with us mindset. It's important to walk alongside Indigenous patients in their health journey, ensuring that they are heard, seen, and respected. This approach embodies allyship, where the patient is the central voice in their care rather than being passive or marginalized. By valuing Indigenous perspectives and incorporating their preferences, nurses can build a foundation of trust, allowing for more effective, culturally competent care. By actively engaging in these practices, nurses can play a significant role in promoting equity in healthcare access and improving health outcomes for Indigenous populations.